A very good morning to all students. Today we will be seeing about dental management of patients with renal diseases. So this is a very important topic in oral medicine and radiology, which can carry a couple of 5 marks and also essay questions. So coming to acute and chronic renal failure and its causes. So kidney failure can be due to three etiologies. It can be pre-renal etiology, post-renal etiology, and renal etiology. In pre-renal etiologies, we can see gastrointestinal losses, excessive perspiration, lot of hemorrhage or bleeding in the body, burns, which could be second and third degree burns with fluid sequestration, renal losses, cardiovascular failure, liver failure, etc. Under renal etiology, you can have acute glomerulonephritis, which is an inflammatory condition, which is followed by acute tubular necrosis. They can be vasculitis and other collagen-related vascular disorders, and they can be malignant hypertension and drug-induced interstitial nephritis. Coming to post-renal etiologies, it can be bladder outlet obstruction, prostatic hyperplasia, bilateral urethral obstruction, and urethral obstruction. The other etiologies for chronic renal failure can be diabetic nephropathy, hypertensive nephrosclerosis, chronic immune glomerulopathy, chronic tubulointerstitial diseases, metabolic disorders, and also polycystic kidney diseases. Now, coming to the oral medicine aspect, what are all the clinical manifestations of such patients? We can notice a halitosis followed by uremic odor of breath. There can be xerostomia and also Sabarol's tongue, which is nothing but white coating all over the tongue. There can be presence of petechiae and numerous ecchymosis in various parts of the oral cavity, and also presence of different forms of candidiasis like erythematous candidiasis, pseudomembranous candidiasis, angular cheilitis, atrophic candidiosis, or a mixture of all of these. There can be frequent ulceration. We can also see uremic stomatitis, which is a very important factor which is seen in such patients. There will be pallor of the oral mucosa, followed by anemia, and also a decrease in the production of erythropoietin in renal failure patients. We can also see dark brown stains, which can be present on any prosthesis which is present in the oral cavity and also in the palatal region due to increase in the urea concentration in the saliva and also accumulation of the same on the surfaces of the teeth. Coming to radiographic features, we can see something known as Brown's tumors, which are giant cell lesions. We can also see demineralization of the bone, loss of bony trabeculae, ground glass appearance, loss of lamina dura around the teeth. Then we can also see socket sclerosis, pulpal narrowing, and presence of calcification in various parts of the jaws, and also floating teeth due to the complete absence of vertical and horizontal periodontal bone. Coming to the oral manifestations of end-stage renal disease, we can see xerostomia, we can see diabetic sialadenosis, dysgeusia, burning mouth syndrome, recurrent oropharyngeal infections and other forms of periodontal infections. We can see dental caries and also oropharyngeal candidiasis. Thank you.